Hi everyone, so welcome back. I'm going to talk to you today about the number one question I get asked, which is how did I become an aesthetic nurse practitioner? I'm going to tell you exactly what I did step by step. So my journey started years ago. I went to University of Miami's accelerated nursing program. So I began nursing school in January of 2013, and then I was able to finish by December of 2013. Now, it was a 12-month program. The reason why it was so fast, I did get an RN BSN in those 12 months. I know it was crazy, was because I had a previous bachelor's and I had one in health science. I knew that I wanted to be in the medical field, but I didn't know in what exactly. I didn't know what field, what specialty I wanted to be in. So what I did before nursing school was I volunteered in a bunch of places. So I was able to volunteer in emergency rooms, in fire rescue, and all types of floors in the hospital, family practices. And so that allowed me to realize that my heart was in emergency medicine. So I entered nursing school thinking, for sure, I'm going to go into emergency medicine. But around 6 months down the line, I got other signs. So I started meeting people in aesthetics. And yes, by signs, I mean signs. So I started meeting a bunch of people in aesthetics. One day in a clinical rotation when I was in the nursing program, I met a clinical instructor. She was just there for the day substituting. She actually worked in aesthetics. And then little by little, I started meeting other plastic surgeons in the field. So I thought, maybe this is it for me. Fast forward to the time where I have to take my boards. I did pass on the first time, the NCLEX exam. After boards, I remember sitting down at the table and saying, okay, now it's time to look for a job. So I didn't know where I would start. I did think about emergency medicine, but then I also heard that they don't hire new graduates. So and I thought maybe family practice, but then of course I always thought about those signs in aesthetics. So I did listen to them, and what I did was I mapped out all the plastic surgeons in a certain area where I wanted to work. And I said, I'm just gonna show up to the offices and see if they're hiring. The reason why I decided to show up is because I knew aesthetics and plastic surgery was a field where they didn't promote as much on websites such as Monster or Indeed. So I knew that the only way I would land this job would be if a nurse got pregnant or had to move out of the state, or possibly was pursuing an additional degree like her master's. So I did decide to give it a try. I did go fully dressed as I would for an interview, just in case the doctor was available or the manager was able to speak to me. So I decided to dress up on a Monday morning. I show up with, first of all, I had gone to the library and printed a bunch of resumes. But anyways, Monday morning, I show up to the first plastic surgeon's office. And I remember going to the front desk girl and saying, hi, I need to speak to the manager. And she said, for what? And I said, well, I'm here for a job and, trying to get a job interview on the spot. She said, well, she's busy right now. And the first thing that popped into my head was, well, I'll wait for her in the waiting room, and then you tell me when she's available to speak to me. So my wish was granted. She did give me the time. I walked into her office. I told her I'm a new graduate from the University of Miami Accelerated Program. I told her what my goals were. I told her that I wanted to desperately work in plastic surgery. I was eager to learn. I was motivated. I was a very fast learner. Before you know it, she was telling me that there was a nurse that was pregnant. In fact, she was 8 months pregnant. So the following week was when she was gonna start looking for a nurse, and I just happened to walk by. So this is why I always tell students to walk into offices, is because now instead of getting a resume faxed through the machine and not being able to put a face to it, now she was able to have my resume not only up front and personal, but now she has my face to compare, okay, who is this person? What degree does she have? What experience she has? So now she can match it. So she did ask me some questions on the spot. Then within about 5 to 10 minutes later, the doctor walks in, the surgeon. So he asked me why I'm there, and I tell him, well, I'm a new graduate and I'm looking for a position. He also begins asking me questions, and before I knew it, within 30 minutes, I landed the job and I was getting sized for a uniform. So my goal was always to become a nurse practitioner. I never really paid attention if I wanted to be in aesthetics. That part of it, I hadn't gone that far, but I just knew I wanted to just get additional education and be at a higher level in the position. But for now, I knew that plastic surgery is where I wanted to be. So within about 2 months, I began an online program for nurse practitioner, which worked out great because I was able to work full time and then go to school part-time. So it was a 2.5-year program. I did not tell anyone that I was going to school because I was scared that they were going to think that I wasn't able to handle both, considering that he was a very busy plastic surgeon. He ended up finding out when it was time to do clinicals because then I had to go part-time. And he was very supportive of it. So I was able to work 3 days a week and then do my clinical rotations. Now, when I started my clinical rotations, I met a family physician that was unbelievably incredible. I mean, the rotation was, I just can't even tell you. It was spectacular. I learned so much. I just remember wanting to be there for way past the hours that I was supposed to be there for. So in the end, he saw that how eager I was, and he actually needed a nurse practitioner, and he wanted to hire me. But of course, when I compared both family practice and plastic surgery, or the aesthetic field, I found the aesthetic field to be for me. So I went back and I told my plastic surgeon, I'm gonna stay in plastic surgery, whether you hire me or not. If you don't hire me, I will be going to the plastic surgeon's office. So he took the offer and he hired me as a nurse practitioner. I just told him I was interested in doing injections. So this was just the beginning. There's no schooling for being an injector at all. Right now, there's only, number one, you have to get certified first. So I will link on the bottom where I did the certification. They do go around the country. However, when I wanted to do it, they were not in Miami at the time, which is where I practice. The next class was in New York, so I flew the following weekend. I was so eager, and I flew to New York to take the class. It was a weekend course of neurotoxin and dermal fillers with the Aesthetic Skin Institute. As again, I will link it on the bottom so you guys have the information. These are expensive courses, so I was very lucky that my medical director was able to pay for them. So now I was certified. But then, of course, you need a lot more training. So that was the other thing. Now, luckily, he's a very, I would say, famous plastic surgeon. He's pretty well known. So a lot of people were willing to train me, from other plastic surgeons, other PAs, other nurse practitioners. I quickly got on with the rep for Galderma. So Galderma is the company that sells the Restylane products and Dysport. So the rep that I met was absolutely incredible, and she helped me so much in doing so many trainings with so many qualified and amazing people. About aesthetics, it's very hands-on, okay? Obviously you have to study anatomy, and you have to go to trainings, and you have to go to conferences, but at the end of the day, you do have to do it, okay? So she would tell me, just do it. Once you understand anatomy, once you have done the trainings, and you understand all the concepts, then it's time for you to do it. So I did practice on a lot of friends and family. I cannot stress that enough. You cannot just grab a needle and just start injecting people. You need to practice a lot before you get the first paying client. And once I got comfortable, then I started taking clients in. Now, I always tell people the best, in my opinion, what I went through, the best way to get in aesthetics is with a plastic surgeon, because their heart is in surgery. That's what they went to school for. They love to do surgery. But if they have a nurse practitioner or a PA, or in other states, a nurse can inject in Florida, but in other states an RN, then they're most likely to hire you, because they'll not only be making money in the OR, but they'll also be making money outside of the OR. There are dermatology offices that do have a lot of injectors, so that is a good one as well. I just know plastic surgery, that's all I was trained in. And by the way, you guys, I went, as you heard my story, from nursing school, new graduate, directly to plastic surgery, okay? I never stepped foot in a hospital except for my clinical rotations. So did I have a lot of other people telling me, oh, you're gonna forget all the medicine and you'll never get hired anywhere else? Yeah, a lot of people told me that. So it was something that I had to choose where my heart was in. And so I knew deep down inside aesthetics was for me. So I said, well, if I'm not gonna ever change, or if I love the aesthetics field, why would I want anything else. And now, within all these years that I have been doing aesthetics, I could not be more thankful. I am so happy in this field. It's like you make people happy. Some people even come out crying because they're just so happy. You know, you don't know how many insecurities that people have, and just bringing joy, it's amazing. So that was my journey, step by step. I know I get a lot of messages, especially on Instagram, and I'm very vague. I just go, hey, just step in a plastic surgeon's office. But that's what I did step by step. So I hope you guys found this video helpful. If you have any questions, please comment down below. And don't forget to subscribe, you guys. And leave comments on what you want me to talk about. I just started this YouTube channel, so there's gonna be a lot more videos to come on fillers and the type of products and which fillers right for you. And I'm also gonna have more videos on my patients. I actually have one coming up now when I start work. So that'll be pretty fun for you guys.